The association in disrepute. They put TAPAS into disrepute. But by and large, TAPAS is a brainchild of government. You need to, that time, thought it befitting that healers can cushion government's effort in primary health care delivery and put an association called TAPAS. But some of our members, within the 40,000, are not genuine. They are not really helping the government at all. They are just disservicing our organization and disservicing the community, giving a very bad service and very bad image. But they are good ones. So with the association is working out modalities as how best we can screen these people and work with those who merit and throw out those who don't merit. You know, in any given discipline, you have the good and the bad.
Okay. All right, Dr. Vongo, it's been a pleasure. You've given us an insight. We are now more aware of some of these things. But before we let you go, any other thing that you'd like to add to what we've been talking about today? The use of charms on men.
I think on the use of charms on men, is we men, if you love somebody, bring them home.
Oh, and maybe just before you do that, just something that has come up.
Yeah.
Do men even realize they're under this spell? Because some people say they come to realize afterwards and so on. Do they? Can the man even know?
Yeah, they can know. The family members start knowing. But in Bemba, they say, Mutembo fini na consequence, meaning that if you are married, your relatives should also be found at my home, and my relatives also.
Yes.
But you can't only be having your relatives. And support is just going to your relatives and not my relatives. And then people start saying, but what is this? If they find me sweeping and my wife seated, they'll say, oh, what's happened to this old man? He's the one sweeping and his wife is seated. And so on, and washing, ironing, babysitting, and so on. God has given us roles, and these roles should be taken very, very seriously. But now, under gender, we all try to blend it in that way. But I think men should be sincere. Yes. If time has come for them to marry, they should marry. But many, many women have been victims of cheating. 5 years, 10 years, 20 years, courtship, you know. So where are we going as a nation? We need to, courtship is 2 years, 3 years you marry. But you can't court 10 and more years and that. That's far too much. And that puts a woman into desperation. And you'll be one forcing her to go out and look for solutions which are beyond, some of which might be beyond redemption.
This has been Women 360. We've been talking to Dr. Vongo. What the issue for today has been why women use charms on men. And of course, next week on Women 360, we are talking virgining kote. We are done.
I can cast a spell. I can cast a spell. Secrets you can't tell. Secrets you can't tell. Makes a special groove with fire inside of you. Anytime you feel danger or fear, then instantly I will appear. Oh, I'm every woman. It's all in me.
Thank you so much for watching Woman 360. On the program today, we're concentrating on cancer. Obviously, because October is Cancer Month, we're going to be talking to Dr. Christine Kaseba, our First Lady, because she's really passionate about fighting cancer in Zambia. My other guest is a cancer survivor, and on top of that, she's the founder of Zambian Cancer Society. I talked to these two ladies on Woman 360 tonight. This is 360 Degrees of Women Issues, and my name is Judy Ngulube. Now, to start the program, we just want a minute of silence for all those people who've died from cancer. So we take this minute of silence and we continue with the program.
Stand by. We are on.
All right, so cancer is a topic for this evening, and in Zambia, just this year alone, we lost 2 people in the public eye from cancer. We had Robina Muteka from Livingston, as well as Eunice Kawina and from Chingola. For Eunice, it was breast cancer, and it was quite sad because her story was, you know, in the paper, in the print media, in the press from the time, you know, the cancer not really started, but we caught her halfway as a news piece, and then we saw her almost recovering for Robina and then losing them. That was very sad. And it's something that, you know, death is always unexpected, and you can't get used to it. So those stories were quite sad for a nation as a whole. And cancer is being talked about so much in Zambia as well as in Africa. This is just evident from when recently Princess Onyeri from Nigeria was in Zambia talking about cervical cancer. She was at the government complex, and of course our First Lady Christine Kaseba Sata was there as well. As usual, any event that really has cancer, she really is there most of the time to just talk about this. Recently, the First Lady, Dr. Christine Kaseba, received an award in New York. This was just from the Susan G. Komen for Cure. She really had a lot to say about cancer, but at the time of her award, this is what she had to say.
To your left, ma'am.
Thank you.
One more time, a little bit further to your left. Well, thank you very much. Thank you.
One more screen further.
Sir, quickly. Sir.
Thank you.
Women rock. So please join me in congratulating this year's Global Leadership Awardee. I got to get this right. This woman is too prominent and special. She is Her Excellency Dr. Christine Kaseda.
On behalf of the Zambian community, I want to graciously thank you for the esteemed Global Leadership Award. This award reinforces my resolve and dedication to rise and ensure that every woman is given the opportunity to access to quality and comprehensive health care, and that every woman diagnosed with breast or cervical cancer obtains every chance to fight the disease, to recover and enjoy a long and healthy life thereafter. I accept this award and offer a special salute to all that have contributed to the struggle. In particular, I would like to mention the very hardworking men and women from the African Center of Excellency for Breast and Cervical Cancer in Lusaka. I would like to pay a special tribute to an illustrious son of America, Professor Grosbeck-Parham, for his dedication and drive. Thank you, former President George W. Bush and your dear wife, Mrs. Laura Bush, for bringing hope and smiles to the lives of many Zambians, men, women, and children through your efforts against HIV and cancer care. A special thanks to the partners of the Pink Ribbon, Red Ribbon Initiative and my colleagues in the Forum for African First Ladies Against Breast and Cervical Cancer. I equally express profound gratitude to President Barack Obama's Global Health Initiative and the UN Secretary General's Global Strategy for Women's and Children's Health for really placing high priority on women's health. As I conclude, I would like to make a special appeal that as we leave this place today, we need to remember our tasks and opportunities to make a difference in the fight against women's cancers, especially in Africa, where breast and cervical cancer is anticipated to decimate a good number of its women. We need to act, and we need to act rapidly, and now. We need to save our future, and I believe that future lies with our women. Thank you very much.
Wow.
And Woman 360 wanted to find out more about this passion that she has for cancer. Is it that she's got this background of being a doctor, or is it that she's a mother of the nation? And this is what Madam Christine Kaseba Sata had to say.
You know, I look at this award as I said, it is just going to really re-energize me to fight harder so that we bring dignity back to the many women that have breast cancer, the many survivors of cervical cancer. You know, there's no reason why people in developed countries should be living longer with the disease that is almost killing the entire nations in developing countries. I've been at the receiving end of patients coming in. As you know, my background is that of being a gynecologist. And for years, it was really distressing to see women coming in a late stage where you really can't do much. And, breaking the news and telling them, oh, there's nothing much that we can do, go home and wait to die. We tried increasing the coverage so that people know about preventing efforts. But we found ourselves in Zambia with a situation that we had very limited screening services. And if anything, I think they were the preserve of the elite, people who could be able to afford having a pap smear. The issue of cancer and breast cancer, if you compare the developed countries and the developing countries, colon, lung is very common. Amongst women, you're looking at colon and breast. But because of the established screening services in developed countries, many lesions are picked up very, very early, and something is done for them. You come to Africa, breast cancer is the most commonly diagnosed, but cervical cancer is the #1 killer. And looking at the projections, because, with HIV/AIDS came the despondence of thinking, what are we going to do with our countries? The nations were being wiped out. There was a lot of investments that went in. Many men and women can now live quality lives because of the ARVs and what they're doing to the lives of these. But then comes the question of cervical cancer. Cervical cancer is strongly associated with HIV. And in one breath, we're doing well, we're saving women, they're living longer, but we're not doing very much in trying to curtail one of the strongly associated cancers with HIV. And if you look at HIV, it's really changed the pattern of cervical cancer in the presentation. We're seeing many more young women presenting. For a long time, cervical cancer was sort of cancer of the old, above 45. But we're now seeing 20-year-olds, 19-year-olds coming in with cervical cancer and really advanced cervical cancer. So HIV has changed the pattern. It's also changed the progression, where you thought, okay, fine, if somebody has got pre-cancer, maybe it might take longer for them to develop a full-blown up cancer. So even when you start talking about cervical cancer, because no one really talked about it, no one paid attention. The attention was HIV, the attention was malaria, the attention was maternal mortality, the attention was tuberculosis. And now you come and start talking about cancers to the mind of the Zambians. It's like, why waste time talking about something that you can't do anything? And even when I started talking about it, I remember there would be comments, on the internet blog and say, why does she want government to waste money on something that there's no cure when we can, cure a lot with malaria? And they never really saw, the magnitude of the problem. But now, when former President George W. Bush came to launch the Pink Ribbon, Red Ribbon initiative, and, it was all about cancer. I guess, people sat up and thought, wow, there must be something in this. They listened, and some people started responding, but now you have an entire president coming back the second time, rolling up his sleeves and renovating a clinic, literally cleaning the clinic and painting the clinic and painting for cancer of the cervix. People said, it must be into something, because people know about the PEPFAR money and what PEPFAR has done for HIV. So now, more people are acute to the sense of cancer of the cervix. Many women are actually asking for services. The demand has been overwhelming to such an extent that I get calls from all the medical professionals really saying, "What have you done? What have you done?" Because and also we have hospital administrators calling for their staff to be trained, which is really wonderful. We've managed to create that demand, but now we need to really scale up rapidly to be able to meet the demand that the supply side. So George W. Bush coming really, I think, was a turning point for the fight against cervical cancer in Zambia, and we had already started doing something really nice. We had started already training mid-level providers, because Zambia, just like any other African country, is faced with the, staffing crisis. We don't have as many doctors. We don't have as many health professionals. And we reached a point where we needed to take cervical cancer screening to the point of contact, to the lowest facility. And the lowest facilities, the cadre you find is a nurse, is a midwife. So we took advantage of that and started training our health providers in using the low-tech technology of using acetic acid and a camera. And we had already established that system, but nobody knew about that system. The coming of George W. Bush as well really opened up to the entire world what we were doing. And he was really chuffed, when he found the system. It's connected to a central server, which offers quality supervisory control, and also, in fact, helps build the confidence of the people at the primary health care level, because they are the ones that come in contact with the patient. They are the ones that have to make decisions. But every woman that is seen, they take a photo of the cervix and upload it into the system. Whatever decision they make at that point is recorded in the system. And at the central server, we have experts looking at these photos once a week and being able to see, to look at the decisions that have been made, whether they are the correct decisions or not. And if there are any inconsistencies, the staff at the central place really communicate back to the primary caregivers and tell them, call back that woman, let the woman come back, come for further treatment, or, you over-treated this person, so maybe next time look at these lesions and so on. So it's really working out very well. And, I guess for the people at the primary health level, they get really satisfied on knowing that they made the right decision on their own. So, the service is offering its see and treat on the same day. I lie awake at night when I think of a woman delivering at home, maybe because she doesn't have money, to get to the nearest hospital. She doesn't have the means, she doesn't have the voice of making a decision on her own. And even when she has that voice and the decision, she doesn't have the means to reach the hospital. Sometimes when she reaches the hospital, there is no one to give the care to her. So I lie awake at night thinking, how can I improve the injustice, really like overnight. But I would like to be remembered as somebody who made a difference to women's health. First ladies are usually called mothers of the nation. So for somebody to be a mother, I would like to be remembered that, okay, fine, that first lady was really a mother for that nation because she did what she could, even within the constrained tenure of the office.
Thank you so much. You are still watching Woman 360. You can catch us on Facebook. We are Woman 360. Give us a comment or just give us a question on that same page. Like the page and you'll be with us here in the studios. Now, I told you earlier on that I have a cancer survivor as well as the founder and director of the Zambian Cancer Society. This is Judy Soko, and she's here with us in the studio just to share about cancer as well about, the Zambian Cancer Society, just as we have started October, and to tell us what maybe her organization has planned for this month. Judy, good evening, and thank you so much for appearing on Woman 360.
Thank you. Good evening to you.
Okay, thank you. Now, just briefly, tell us about your experience with cancer.
Okay, I was diagnosed with cancer when I was 23, and that was in 1989. And you can imagine then we hardly spoke about cancer. We did not have a cancer hospital. There was limited chemotherapy, and there was no radiation facilities available. So based on that, looking at all the factors, I was given 5 years to live. Well, fortunately for me, I overcame the disease, and I'm happy to say that I'm alive and well today.
Okay, no, thank God, that's very nice. Now, talking about the month of cancer, I know you are the director of the Zambian Cancer Society. What do you have planned for this month?
Oh, the organization has a major fundraising event, which is planned for next week, Saturday. This event is called Relay for Life, and it's about celebrating cancer survivorship. Very often when we hear that somebody has cancer, we get nervous and we wonder what's going to happen to that person, which is understandable. But we want people to understand that cancer, whilst it's a devastating disease, we can overcome it. We are living with it, and we say, come and celebrate our lives, come and support us. So it's about celebrating cancer survivorship. It's also about us as cancer survivors supporting each other and giving each other hope.
Okay.
And during this event as well, there will be a moment when we're going to remember those who have passed on. So during the remembrance ceremony, we're going to light candles, have a moment of silence, go around the track for a couple of laps, just to remember our loved ones lost. And also, it's about raising awareness about cancer. It's about cancer education messages that we will share. So during our fight back ceremony, each one of us will have the opportunity to take a pledge and say, I will fight back in the following way. For example, Judy may say, I will go for my annual mammogram, or I will exercise regularly. So Relay for Life is about celebrating cancer survivorship, remembering those loved ones lost, and also it's about each one of us taking a role, making a stance, making a commitment to fight back against cancer.
Okay, that's very interesting. Now, taking you a little bit back to your story on cancer, I know there's someone out there, maybe a woman, a man, going through cancer, and or maybe just trying to survive. Where can someone draw the strength? You know, sometimes you say seeing is believing, or you think the person who's gone through it is the person who understands it the most. Because if I haven't had cancer and I'm telling somebody you'll be okay, it's very difficult. But coming from somebody who survived, how can you tell them, what can you tell them about drawing strength? Where did you draw your strength from?
That's a very good question, and sometimes I ask myself that. Because going back to my story, when I was 23, which is 23 years ago, really to speak to someone about the disease was almost impossible, because I really didn't know anyone who had it. So in my case, I leaned very heavily on my family, and in particular my mother. And then, of course, I leaned on God. There were the medical staff whom I could speak to occasionally and explain what I was going through. Right now, there are more people who are coming out openly and saying that they've got cancer. Cancer is not that unfamiliar generally, so there are resources out there. I know it's very difficult. I have been through it. To find someone who can sympathize or understand what you're going through. Having a bad day is okay, and there are very many bad days, and so one shouldn't feel bad that they're not okay. They think it's the end of the world. I also had feelings and thoughts like that, but it's important, I believe, as cancer survivors in particular, to talk to each other and to support each other, because whilst each of our experiences are unique, we share certain common factors. We know about the pain, we know about the vomiting, and in some cases, hair loss and so on. So we need to come out, speak to each other, reach out to each other. And not only for survivors, but those who feel compassion, if they could also come forward and hear our stories, listen to us, you know, hold our hands, that would be great as well.
Definitely. And is your experience what made you come up with the Zambian Cancer Society?
Yes, it
or
was.
Maybe it was just a plan from way back.
It's certainly not a plan from way back. I was diagnosed when I just finished university. I'd started work. So I was geared, ready to live my life to the fullest. So a cancer diagnosis threw everything, you know, off key.
Okay.
So, well, in 2007, many years later, from 2009, I was now ready to set up this organization. And basically, our focus is to offer information and support to cancer survivors.
Now, your organization, I'm sure, being involved in cancer, has done a lot of research on cancer in Zambia. Maybe just some statistics, not very precise, but just approximately. What per year, how many people have cancer in Zambia? Okay,
based on information that we have.
Because I know you also deal with the Ministry of Health. Sometimes you collaborate, isn't it?
Yes, we collaborate with the Ministry of Health. We also work closely with the Cancer Diseases Hospital. Yeah, and based on information from the Cancer Diseases Hospital, they see approximately 3,000 patients per year. Okay. And out of those 3,000 patients, about 33% have got cervical cancer, and then 11% breast cancer, and less than 10% prostate cancer. Those are approximate figures. But then you must remember, Judy, that a lot of people do not come to CDH, do not go to the Cancer Diseases Hospital. So the numbers, we are fairly certain, are much greater than that.
Okay.